You're listening to 90.3 WHPC, the voice of Nassau Community College in Garden City, New York. I'm Bill McIntyre here with Jon Gallo, bringing you news stories about Long Island and about Long Islanders. On today's show, and we'd like to introduce Sara Siddiqui, Dr. Sara Siddiqui from NYU Langone Huntington Medical Group. Am I correct there, Sara?
Yes, you are. Thank you.
Very good. Yes, thank you very much for carving out some time to sit here and talk with us about. I guess really what we're looking to talk is about the opening of the schools and what is going on exactly there. So we came to you.
Oh,
yep. We know you wear a lot of hats, so we know that you're deeply connected to your community in Elwood. Am I correct?
Yeah, I am connected to Elwood. And of course, today I'm not speaking to that part of my hat.
Of course.
I'm speaking as a pediatrician.
Yep,
yes, and subsequently a lot of schools closing and then reopening. And do you think this is going to be the new normal? Are we going to have like school blackouts in certain areas or?
So what's really important to note, the school districts did spend a lot of time over the summer and even after the shutdown, April, May, June, to try to figure out how we would go about or how they would go about opening the schools. So a lot of planning went into that. But I think what you're seeing now, the successful opening in a lot of the districts is happening, but they had to meet certain criteria based on New York State guidelines from the Department of Health and Department of Education. So they kind of all came out with some guidelines that all the schools had to meet in the area. And yes, now you're kind of seeing what sometimes can happen when you have positive cases in the school district or in the area. And a lot of the closings that you're seeing happening is because the school district, as well as the local Department of Health, has to identify and contact trace anybody that's been exposed to a primary positive contact. So what you may be seeing, I know it's confusing, when you kind of hear about it, that this such and such middle school closed or this such and such high school closed. But what we're seeing is that the school closure is it's a short amount of time so that they can identify which students need to stay home or could have been in contact with the person that was positive. And then everybody else comes back in a day or 2 days, depending on how much of the school was exposed.
Okay. And do they are they cleaning the school in that time, in that downtime?
So the school's cleaning procedures are that was also part of the guidelines that were enacted, and that was part of the things that were being involved in being able to open the school in a certain way. And so the schools are being constantly cleaned. What happens when you have a positive contact is they go above and beyond that and try to identify who was close contact. So close contact, defined by the CDC and our Department of Health, is someone who's been within 6 feet for more than 15 minutes. And just actually yesterday, CDC kind of updated that to make it a cumulative 15 minutes. So it doesn't have to be 15 minutes together, but that still kind of just came out. So we're going to, everybody's kind of wrapping their heads around that component. But essentially the schools are being cleaned constantly.
Yeah, right. We know it's an ongoing 24-hour kind of battle, would you say? But I guess one thing I was curious about in terms of the contact tracing, is that something that, again, is dependent by school district in terms of opting in, opting out? Or is that something that is kind of like vaccinations, which I know we could talk about also is important in this situation? But is that something that's a mandatory, again, kind of policy where you need to opt into that policy of contact tracing for your kids?
No, that is one of the policies that's enacted, that the Department of Health has to be notified for any contact, any positive contacts in the district. And the Department of Health actually coordinates with the main, each school district is supposed to identify one person, and in most districts, it's the superintendent. That's going to be the point person, responsible for the contact tracing, and they have to contact Department of Health, and then Department of Health does the recommendations and what the school should do. So closing for 24 hours, and then identifying, or closing for whatever amount of period of time until they identify all the people that have been in contact, and then trying to contact those people. So that's all part of the school's opening plan.
It's good to see a lot of this stuff was worked out ahead of time.
Absolutely. Yeah. And I think one of the other things that I can say is that the Department of Health also gave school districts guidance on, they had to give plans on the reopening 3 different ways. So fully open, fully remote, and hybrid. So all districts had to have a plan in place regarding all those 3 options and how they were going to do it.
That's great. Yeah. I know we spoke with the president of our university, our alma mater here, Nassau Community College, and he spoke about, again, just how gargantuan of a task that was, but how much they're appreciative of having to deal with it then, again, that planning versus having to figure it out on the fly after what you put all your eggs in one basket and, then something goes sideways. So, yeah.
I think a lot was learned during the March shutdown, that was a very sudden thing. Nobody was expecting that. And I think we did learn a lot from that. Most definitely.
I know, Gil, go ahead. Do you have another thought?
No, I'm thinking of all kinds of things, but
I know something.
The contact tracing, that's got to be like a spider web going out into, does it end?
So yes, so that's it, right? So what? There's clear definition of a contact to a primary index case. So actually, I have to give credit to my superintendent that kind of explained it very nicely in a letter that he sent out to our community. Basically, if you think of A, B, and C, so A being the primary contact person that was tested positive. B is their direct contact. So the people that were directly exposed to that person within the 6 feet, 15 minutes, or depending on specific criteria laid out by the Department of Health. Those are B. Those are the people that have to quarantine for 14 days. The primary person that was positive has to isolate for 10 days. So that means that they need to stay inside their home, not leave, and not contact anybody outside. And then the primary contacts, so those B people, are 14 days of quarantine. They're going to wait. They're going to see for symptoms and maybe get tested as well, depending on their primary doctor's recommendation. Then you have C. So C are the people that are contacts of the contacts. The contacts of the contacts do not need to isolate or quarantine at this time. So that's a really important differentiation. And that's where the spider web kind of was getting confusing. But as soon as they kind of outlined that direct definition, it has made it a lot easier. Of course, when you have the B people all getting tested, hopefully everybody's negative, but if there's a positive person in that B population, now C's become B's.
I see.
So that's how, yes. So that's where it does have an ending. You just have to kind of know, exactly how things are being defined.
Oh, it makes sense when you see it all there in like a nice clean infographic.
When you have it like that, it does make a little bit more sense.
Okay. And another thing I know that we spoke about before, Bill, and I know you had a personal connection to, I believe, with a family member, if I'm not mistaken, who was a school nurse. Can you speak a little bit, again, I know there's always been issues, with trying to fund, kind of different ancillary, kind of, whether it's social workers or, again, nurses or other types of counselors on school campuses. Can you talk a little bit about that, I guess, how they're kind of playing into this situation on the front lines, would you say, I guess, of the schools?
Yes, I have to say that the school nurses have completely stepped up and right into like the position, and they're advocating for not only the health of the entire school community, the staff, the students, but also themselves. I mean, it's really important to note that they have really stepped up, and they are really a big part of a lot of the task forces that were made. Even New York State, there was a New York State return to school task force that many nurses were involved in. And the school nurses, I have to say, have really organized quite well and a lot of the like school notes, return to school, symptomatic treatment. So, we had to talk about all this over the summertime, that, what would happen if a child was in school. So that's going to inevitably happen, right? We're going to go into like the cold and flu season where you might have a child that comes in that was not symptomatic in the morning, but by the afternoon becomes symptomatic. What do you do with that child? Where do they go? So the school nurses and social workers, all the principals, administrators, teachers, they all kind of got together and made a plan that, yes, you're going to have a larger area where the child has to go until the parents come in to pick them up. And what is the school nurse doing as far as evaluation and then further guidance. So those are all planned. These are all things that have really been planned out and very well thought out, I must say.
Yeah, when we first started talking about it, we were all talking about teachers and how if a teacher gets it, now you need a substitute. But what we got down to was the idea that most schools only have one nurse. And she was the point person because anybody in the school suspected whether they had a high temperature or whether they actually had symptoms. The first place they were going was to the school nurse. Mm-hmm. She or he was the point person. And we were wondering, well, what happens when the school nurse gets it? We're worried about substitute teachers, but lose the school nurse. Oh my.
Because there actually are some districts that don't even, and this I recently found out about, that there are even some school districts or some schools that don't have a school nurse that's in each school. So yes, this is a setup for something that can be quite concerning. And you're right. And we are, hopeful that we don't get cut in state aid or funding, or because there is a lot of that can impact. And that's why, right, that some schools may not have a school nurse in the school building because the funding isn't there. Yeah. Right. And unfortunately, yes, that is something to be very, very concerned about because you do need a person that's kind of like the medical point person in these scenarios.
Of course. And at least just to keep it consistent, however you dealt with it, you kept consistent pattern. Now, the other thing is everyone's anticipating, and only Providence knows when it's going to come, but the vaccine for the epidemic. In the meantime, we're being told the flu season is here. Yep. How do flu shots fit into this whole equation?
Well, that's a great question. So as a pediatrician, we are highly, highly recommending the flu vaccine for our patients. So I start off by saying that the flu vaccine has been around for a long time. We do know, and every year there's a new flu vaccine that kind of is produced early in the year, and they base it on data that they get from the Southern Hemisphere to try to identify which are the most common strains that are going to be in the flu, like the flu strains of this year. So they identify between 3 and 4, and they place those in the vaccine. It's not 100%. It's a little bit of a guess and a little bit of a an educated guess, but it's a little bit of a guess. On a good year, you'll get 30% efficacy. But I do like to point out a couple of things. So one, you do not get the flu from the flu vaccine. It's completely a killed virus. And so you may get an immune response. You may get in that first 24 hours, your immune system, aches and pains, fever, which is all a part of your immune system getting inspired and building antibodies against the virus that you got as the result of the vaccine. So it does reduce the severity though. So, and it reduces hospitalization. So we do know last year, 80% of hospitalized children, as a result of the flu were unvaccinated.
Wow.
So that tells you that the vaccine did successfully keep, some children may not have been hospitalized because they were vaccinated. The other thing we do know, and the other difference between flu and COVID, or one of the differences, is that flu does affect younger children and the elderly, but it has more propensity to give severe symptoms to younger children. And the other thing we do know about the flu is that it can spread from child to adult or child to child. So by protecting or by encouraging more people to get the flu vaccine, you also reduce the transmission. So you may not reduce 100% getting the flu. You may still get the flu during the season, but it will reduce severity and reduce transmission. So that's really important because you don't want a twindemic. So what we want to avoid is a flu pandemic, which there are years, and I'm sure you remember H1N1, the swine flu. It was, before this one, it was one of the worst epidemics that I've gone through as a pediatrician. The swine flu was quite rough, and fortunately we had a vaccine though, and we were able to protect a lot of people through that. But we don't want to see flu, and then as a result of flu, decreasing immunity and people picking up, perhaps both. So that's why we're heavily advocating to try to get flu before boo. So I don't know if you saw that hashtag. And basically that means to try to get it before Halloween, but now we're approaching Halloween. So you could still get it even after Halloween. But, try to get your family and friends and kids. And if you're in good health. So that's the other thing. We do kind of review. And again, you should talk to your pediatrician or your primary care doctor. But we are advising flu vaccine for everyone. Okay.
And I know we will touch about maybe some safe trick-or-treating practices down the line, but I did just want to stay on that for a second. In terms of trying to think, not only I was curious about recess, and that's a whole other story, but I guess regarding, that's what it was. Sorry. Other vaccinations. Of course, we were thinking about the flu season right now, but obviously there's all those other vaccinations that are regularly scheduled for children to get, mumps, rubella, things like meningitis. Obviously, do you want to speak a little bit about the importance of making sure that even with everything going on with COVID, that people don't delay that essential, schedule of keeping your kids safe?
Yes, absolutely. It's so important. And that's one of the main reasons, even after the whole shutdown happened in March, our offices and many pediatricians' offices and many healthcare offices, private practices, stayed open because we knew that we need to keep our preventative care going. We knew that we still need to see the small, young babies, infants. Babies were still being born during the whole shutdown. The hospitals were still having deliveries, and we need to see those babies within the 2 days of discharge that we usually see. We needed to see those 2-month-olds and 4-month-olds and 6-month-olds to make sure that they were still maintaining their vaccines, because as you just mentioned, we did find out by May or June, that there was a decrease in the vaccination rate by almost 90% because people were taking the stay-at-home orders very seriously. But unfortunately, we were seeing that the vaccination rates, and the way they found that out was because the ordering of the vaccines had gone down. And as compared to last year, they found that there was a huge drop. And so when that happened, we tried to really up our efforts to try to help people to know that the offices were still being open, and we were trying to keep everybody safe, trying to bring people in one at a time directly into the exam room. We were checking temperatures. We were keeping healthy and sick people out, healthy and sick people separated. But we really needed to make sure that we didn't decrease the vaccine rates to start seeing other illnesses that we do have vaccines for. So, for example, measles, meningitis, pneumonia. So all those things we do have vaccines for that we need to continue vaccinating. So yes, it is really important.
Do you think is it possible for you to continue to see as many patients as you did pre-COVID?
No, not at all. We've changed our whole way of practicing. The last 6 or 7 months have been a whole turnaround about how we practice. And honestly, it's a good thing to kind of keep the well patients apart from the sick patients. But we've had to really modify how we see our patients. We've had to modify, obviously we wear PPE, we're all gowned up in the office. We're if you see me, that's why I love the Zoom way, because at least I get to see faces. But you cannot, you don't see my face when you see me in the office, and it's we just have to do what we have to do, right? But we have. Just
in an anecdotal story, I know someone who just made an appointment with a skin doctor, just wants to have, and they said, well, okay, we can make an appointment for you, but it's January 21st.
Right.
And the way that the schedule goes now is that you pull up in the parking lot and you send a text that you're here. And then someone says, okay, sit tight. and then they send you a text back when you're okay to come in, and you walk into an empty waiting room.
Yes. There's no waiting in the waiting room anymore. You're waiting in your car.
Yeah.
You come in when the exam room is ready. You come into the room, and then even when you're checking out, there's not a crowd. And we kind of have you exit quickly too. A lot of things are paperless right now. We have electronic medical records, which has all come in very handy. And then the other thing that we're doing is virtual visits.
Yeah,
a lot of virtual visits are happening.
But that's something that's going to be interesting, and it's, I'm sure, difficult enough, as I'm sure you see, in your experience and other physicians, to get, patients to communicate everything and to, really kind of get a full grasp of what's going on in the visit that you have there. But let alone with children now, trying to deal with through Zoom, where you can't maybe get all those little nuances and all those little, again, small details that you might be able to pick up from your experience. I'm sure that's a whole other challenge, I guess.
It's a challenge, but I did find some positives from it. Yes, obviously I can't listen to your lungs. I can't look in your ears. But I see the parent and child in their home. I see, I still get to, mean, a lot of kids I hadn't seen in so long, and it was so nice to see them, through the Zoom, through this technology that we have. And, there were things that we could diagnose. We could do rashes. There was a lot of mental health issues that we were able to talk about over the virtual visit, and really people were so thankful for that. And it was a way for us to continue doing what we're doing, but while keeping everybody safe. So honestly, there were some positives, and I think virtual visits are here to stay. I'm hoping they are, because in some instances, sometimes the specialist may be far away, or, you can do like a verbal visit or a more talking visit. And I think access to care will really, improve. Sometimes definitely a physical exam. I love the physical exam, and I love, seeing my baby, seeing the children. That's always the ideal. That's the gold standard. But we did see some positives out of the virtual visits.
Of course.
Yeah. Hopefully the technology will come about where people could, go on Amazon and order a heart monitor, and they could plug it into their computer, and you could see all the data when you spoke to them.
Just like your
That's
Fitbit
actually
or something.
It's already present. So it's
right. Well, I know that there are teams that have that kind of thing, but I'm talking about for the general public to be able to plug in and give you a quick call and say, my heart looks like it's doing funny things.
I see some advertisements now. I think Amazon's selling like a EKG that has some kind of a medical company behind it. So it is a very interesting thing to see how many developments kind of have been happening so fast due to the need for them. Let's just remind our listeners that they are listening here to This Week's Long Island News on 90.3 WHPC, and we are here with Dr. Sara Siddiqui from, again, NYU Langone, Huntington, a pediatrician there in their medical department. So, again, I know, like I said, there is a lot of kind of complexity and kind of dry, difficult things that, we do talk about. But, at the same time, your patients are kids, and we want to keep it light for them. And I know, people think of, give them the lollipop and all these types of, again, creature comforts that make them feel welcome. Maybe if they have to deal with a boo-boo, as they'll say, or, maybe an injection they need that they don't really want to take. But I guess, could you speak a little bit maybe more too about that type of care in terms of that types of, kind of personal touch again? And like I mentioned before, the difficulties maybe like in schools of recess and trying to, again, deal with the social emotional needs of students, while trying to have to adapt to this new, like we said, digital divided kind of age.
So I have to say that, yes, when you come into our office now, I'm masked, the child is masked, the parent is masked. But what's amazing to me is that they're so happy that they're coming in, and they get to kind of see someone and talk to them, and they can see my eyes smiling through my mask, and so they are smiling, and it's really a nice interaction that we have. They can hear my voice, they can hear that I'm like excited for them, and then sometimes I get happy seeing them, even though we're in our masks. So that social interaction, we are concerned about how the kids are missing some of those, just even the ones that are that we would take for granted, like going to Target with your 2-year-old and, for them just seeing all the facial expressions and all the different noises and all the different like sounds and chatter. And so I would comment to my patients when they would come in, especially now, you have to try harder now. You have to really make an effort to make sure that they're hearing those sounds. You're going to need to find, like, our library has many, many different programs that you can sign up for, reading to them, and there's story time, and there's, group Zoom times, and then FaceTime to your relatives, and FaceTime and Zoom, to family members, and really try harder to get the kids to hear different voices. So that was very important. And then speaking of school, I have to say, one of the main pushes for school reopening was so that the kids could kind of get together again. Yeah. And I think that they appreciate it. They're wearing their masks. We were very worried. Initially, people were very worried. And there are some kids that do still have maybe a little bit of difficulty. But I can tell you right now, I ask, one of the first questions that I ask, because a lot of the children do either hybrid, they're doing online and in-person school. I always ask, well, what do you like better? And a large majority of them say in person. And I said, you don't mind the mask? You don't mind like that you have to do all this stuff? You have to kind of stay separate? And they said, absolutely not. I love being in school. Yeah. And I want to stay in school.
I think seeing people is reassuring.
Just like the parents, a lot of times you might not want to get up and go to work in the morning, but if you haven't done it in months, you want to see some other people, you want to have that experience. So,
well, I thought the kids were going to be a little disappointed because they were going back and expected that socialization. And I'm sure it did not happen at the level that they had hoped.
Right. It's much different. But children are so resilient.
Yeah, true.
I gotta say,
true. I think just seeing people probably has to be reassuring. Oh, they really are still there. They're not just on my screen.
Exactly. Yeah. They are so resilient, and they know that it's a little bit of a different world. We can learn a lot from children. I always say that. I learned so much from my own kids. My own kids taught me so much.
Amen to that.
The way they've kind of just stepped up and they're in school and they're following all the directions and they're, doing the one-way hallway. I don't know if you've heard about the one-way hallway, but literally, if you have a classroom right there, you're not going to that classroom. You're going to go around the whole school up and down. And they do it. And
sometimes for the little ones too, I know, like gamifying it, making it seem like, okay, we're going on an adventure. We're going the long way now,
I think one of the other things that we thought of, though, too, is that idea that when kids were homeschooling, they basically spending the day in front of their computer screen, doing what they've got to do. And then when it comes time for a break, they move to another screen and play a game. And life exists in front of screens. Yes. And this was never really that much of a consideration before. But now we're starting to view this as an addiction in many cases. And one of the best examples was if you look at the front row of any major concert, everybody's standing up there with it's almost as though they have to experience life through a screen or it didn't happen.
Yes. So the screen time, we are very, very concerned about the increasing in screen time. One of the first things I do also ask the children when they come in is, what are you doing outside? What are your activities? Are you involved in any sports? If you're not involved in any sports, are you going outside? You really need to go outside, breathe that fresh air. If you have a dog, go walk your dog. Don't let your mom walk your dog. Right. You need to get outside and do some activity every single day. And the other thing that I kind of go over with the kids is because we are seeing not only the increase in screen time, but increase in neck pain and back pain and even wrist pain that comes from just being on the computer and hunched. And these things don't happen to the kids usually. That's happening to, our age people because we're kind of doing that work. But the kids are having those pains. And so what I try to tell them is try to do like shoulder rolls or neck rolls every half hour, 40 minutes, at least for like a few minutes, and to really concentrate on like your core support, exercise, like work that core, do some planks, do some sit-ups. It's so important. And we have to limit the screen time. We have to kind of, if you're not in school, then, you need to not use your screen as a way to relax or to, you got to give up some of that other things because unfortunately, we are on the screen a lot. And even when they're in school, they're using the screen.
Exactly. Yeah. And we think this is good advice for not just the schools, but the parents. I know a lot of us as well, kind of being in this kind of new routine routine of the 9 to 5, which seems to extend even more so than regularly somehow beyond those hours. But it's a whole other story.
I'm still fighting the new normal tag. I don't like that.
We don't want it to be normal. We want it to be temporary.
Yes. But, well, listen, we thank you so much for coming and talking to us and telling us what's going on behind the scenes there.
Oh, anytime.
Keep up the good fight. It's
definitely
you folks on the front that, will... in New York, we basically kind of said that, because we look at the rest of the country, that it was the masks that brought the numbers in New York down from 700 a day, as I remember at one time, down to 1 or 0. And we're still arguing about masks.
I got to say, yes, masking works. Masking works. If we have a universal masking policy, it's just a piece of cloth. We can do it. Yes,
I think
they're out there really because they're available now. They're being given out for free by plenty of institutions and organizations. So definitely,
I think the country is going to find out that masks work. Hopefully, sooner than later.
Exactly.
But
I agree.
And we want to. We want to thank Sara Siddiqui from NYU Langone Huntington Medical Group, the pediatrician. So we do have experts on this show. It's not just me and John.
And
you guys are awesome.
I don't know how you. I don't know about the shade maybe towards the county executive there and the DA we've had on recently, but we appreciate all our guests, all different members of the community.
Definitely.
Again, handling all the
very much.
And we'll just remind voters. Listeners. There's my giveaway there that. Please, again, Election Day is coming up very soon. I know this is an issue close to your heart personally.
Vote.
It's important to make sure that your voice is counted. Regardless of who you vote for, make sure you look into all your options about early voting still, absentee ballot, you can still have time to request, or early voting in person at your assigned early voting location, which will start this weekend. You can look up more information on the Board of Election websites in Suffolk and Nassau County.
Beautiful.
It starts Saturday. Early voting starts Saturday.
This Saturday.
Thank you very much.
And enjoy everyone's Halloween.
for joining us. And just a reminder, all of you out there, you've been listening to 90.3 WHPC, the voice of Nassau Community College in Garden City, New York. Thank you.
We'll
see you next time.